Is family medicine the smartest medical career move in the UAE in 2026? This is a critical question for doctors planning to work in Dubai or other Emirates, especially because career titles, licensing, and salary brackets function very differently compared to many Western systems. Before discussing career strategy, it is essential to clarify one major point. General practitioner and family medicine specialist are not the same in the UAE. They are classified differently by licensing authorities such as DHA, DOH, and MOH, and this distinction directly affects job roles, salary brackets, and long-term career progression. A general practitioner in the UAE is a medical doctor without a recognized specialist title. Importantly, a GP is not limited to primary care clinics. GPs can work in clinics, hospitals, emergency departments, inpatient wards, and polyclinics, depending on their license and employer structure. A family medicine specialist, on the other hand, holds a recognized postgraduate qualification such as MRC-GP, Arab Board, or an equivalent specialist certification. They are licensed as specialists, not as GPs, and typically have a broader clinical scope and higher clinical authority. At the highest level, a family medicine consultant is a senior specialist with significant experience. Consultants usually have greater clinical responsibility, leadership roles, and advanced decision-making authority. They may work in hospitals, large medical centers, or high-end private clinics. Looking at salaries, GP roles in the UAE typically range from approximately 10 to 30,000 AED per month. This varies based on experience, workplace setting, and whether incentives are included in the contract. Family medicine specialists fall within specialist salary brackets. This commonly ranges from around 20,000 to 55,000 AED per month, with higher earnings possible in private sector clinics and high patient volume settings. Family medicine consultants fall within consultant salary brackets, typically around 40,000 to 90,000 AED per month or more. Higher income is often associated with experience, reputation, leadership roles, and patient volume rather than just the title alone. Family medicine is often misunderstood in the UAE job market. Some job listings label roles as GP even when the work resembles specialist level primary care. However, the official license title still strongly influences salary, hierarchy, and long-term opportunities. Demand for family medicine in the UAE remains consistently high, with a growing population and increased focus on preventive and chronic disease management. Primary care specialists are needed in clinics, hospitals, and polyclinics across the country. In terms of work setting, both GPs and family medicine specialists can work in multiple environments. GPs may work in clinics, hospitals, emergency departments, or wards. Family medicine specialists often lead outpatient care and primary care services, but can also work within hospital-based outpatient systems. One major difference between the two paths is entry speed. The GP pathway usually allows faster entry into the UAE job market, especially for international doctors seeking immediate employment. The family medicine specialist pathway requires recognized postgraduate qualifications but offers stronger long-term career positioning. Clinical responsibility also differs significantly. GPs typically perform broad general medical duties with scope defined by the employer and facility. Family medicine specialists usually take on specialist-level decision-making, chronic disease management, and preventive care leadership. In the private sector, many family medicine specialists work in high patient volume clinics, Income in these settings may include incentives and performance-based structures, which can significantly increase total earnings over time. From a financial perspective, the UAE tax-free income system is a major advantage. However, specialist and consultant titles generally provide higher long-term earning potential compared to GP roles due to stronger negotiating power and higher salary brackets. The GP path may be suitable for doctors who want faster employment, flexibility, and entry into the UAE healthcare system. It also allows work across multiple settings, including clinics and hospitals, making it a practical first step for many international doctors. Family medicine may be the smarter move for doctors with recognized postgraduate qualifications who are focused on long-term career growth. It offers higher salary ceilings, stronger job stability, and better positioning within the healthcare hierarchy in the UAE. In conclusion, general practitioner and family medicine specialist are distinct career paths in the UAE, even if their clinical environments may overlap. Your official licensing title ultimately determines your role, salary bracket, and long-term career progression. For accurate career planning in the UAE, clearly understanding this distinction is essential before making any strategic career decisions.